I think the Level Pelvis Method is very helpful in both the hospital and office setting, not only for midwives, but also for obstetricians and family practice doctors who deal with a lot of pregnant women. Quite often what happens during later stages of pregnancy, women come in with pain, significant lower back pain, hip pain, sometimes sciatica, and there's not a whole lot of treatment options that we've had prior to learning the Level Pelvis Method. Usually we've had to send these women out for physical therapy, which may or may not help, or they've been put on heavy-duty narcotics just to get through the rest of their pregnancy, which is not good for them or their babies. With the Level Pelvis Method, you get an extra option to try to help alleviate this pain and to alleviate any further problems with the pregnancy that are due to the musculoskeletal changes that the growing baby causes. The workshop for me was exceptional because it gave me that tool that I could use with often immediate and dramatic results so that I did not have to refer these patients out to pain specialists or physical therapy, which may have been harder for them to get into and had them be in pain for that much longer. I really highly recommend that practitioners who deal with pregnant women, either in the office or when they're in labor, including midwives, doulas, obstetricians, family medicine doctors, take this class to help their patients and their practice and help women with their pregnancies have a much more comfortable pregnancy with the Level Pelvis Method. The nice thing about it too is that they can teach their family members and partners how to do it so that this can be done as often as needed in their homes. The Level Pelvis Method is an excellent tool in the arsenal of treatments for pregnant women who are having significant back and musculoskeletal pain.